Okay, so yeah, I'm going to be talking about the hard to reach groups and how some of the things we've done to combat health inequalities and equalities. So I have been working with Alex Streeter-Diego on our Healthier Together programme since we joined in 2020. So just a bit of background, we've been exploring under Firmly Healthier Together how to access the hard to reach groups of children and families in our patch and trying to break down barriers on how to deliver healthcare equitably for all of them. So the barriers, noticing some individuals access services. Oh, can you hear me still?
No, Zara, we lost you briefly there.
Yeah, I thought you did. Sorry, I had a slight error pop up there. So I'm back. So hopefully I'm back. Just shout again if my Wi-Fi does cut out. So language, social economical status, ability to read and write and understand how to help access help and organisations. So noticing that some of our individuals over-access services whilst others don't access them at all. And we've got a wide range of analytical tools we've used to help support us on the Healthier Together programme to demonstrate and evidence the potential barriers. So breaking through the barriers, we've used Firmly Healthier Together in our patch to help us break down barriers and provide an easy read function. Other ways that we've used the programme to access these hard to reach groups is through schools. We've hosted webinars with teachers and parents, specifically using sessions focusing on high areas of deprivation. And in those areas, we also have low attendances of our students. So we've provided health literacy signposting to the Healthier Together website, specifically the know where to go, know what to do when to send your child to school. There's often a perception that people from areas of deprivation don't have access to technology. However, as we've seen earlier today, and also part of us using the app, the development, we found that this isn't the case and people will prioritise smartphones and technology devices in the home. We've recently used our volunteers in both of our ED trusts. We've again done webinars with them, provided them with leaflets and health literacy to use when they approach parents that are in the waiting rooms. And within the leaflets, we've had QR codes that the volunteers are encouraging all parents to click on the QR codes so they can go to our website or download the app and hopefully use Healthier Together in the future instead of turning up to A&E as their first port of call, which is what we've seen. Oh, am I still on, Sanjay?
Yes, you are. Sorry, that's
okay.
perfect.
That's right. I thought it might have gone again. Yeah. So other areas of planned engagement we're going to be doing is accessing the Nepalese communities and also our social workers, which started some of this, but it is in our forward plan to do, because what we've seen from our trust is a lot of children are admitted. I'm sure everybody else has similar presentations, mental health presentations in crisis, and actually a lot of these children and families have social support workers that are in the home on a daily, bi-daily or weekly basis. So we've identified this is a real key area for us to get our children's social workers on board. Okay, so is some of the work we're doing making a difference? So we've got Recite Me on our website, and this is just, I don't know if this is too small actually, probably for you all to see, but this is just a snapshot of our report on Recite Me. So it does over 100 languages in audio and read aloud, and 50 of these languages are translated into text. So this was just 2 separate months I've taken a snapshot of. So what we found really interesting is consistently month on month, English is the highest language that has to be translated into audio, which also supports our evidence that English-speaking communities find it difficult to read and write, and this is great for evidencing that and helping us use it to drive forward more change. There's variation on month on the translation part. You can see there each month it changes depending on what engagement work myself and Alex have done. But using this was just to highlight when we did a piece of engagement with the new to the UK with Ukrainian refugees. Alex went and did a talk in one of the hotels with them, which we saw having no Ukrainian translation on the site suddenly jump to over 1,100 people. So it really does show that the engagement sessions we've had with these small, hard to reach groups really makes the difference. And again, this was just another snapshot of how people access our site, which is predominantly through mobile phones. And actually on those, when you break the mobile phone data down, over 86% is from an iPhone. This slide was just to give another snapshot of some of the partners we've engaged with regularly as part of the programme, myself and Alex. And all of these groups have got access to the hard to reach groups and can help provide education and health literature and help us to access the families as well. One group that we've seen as a real benefit and a success for us was the health visitors. So very early on, when we started the programme back in the end of 2020, 2021, health visitors were probably one of the first groups of professionals that we reached out to, and just we had a simple idea of creating QR sticker codes that they would stick in the little red books, and they're consistently asking us to send them more on a regular basis. They're being used, and it was a quick way to get new parents on board and using our Healthier Together. Okay, that was my little whistle-stop tour.
Zara, that was brilliant. I mean, so much food for thought, and